Assalamualaikum warahmatullahi wabarakatuh. My name is Al-Amin Ashraf bin Zulkifli from SR1134C. Okay, next is the ankle sprain injury of the player rugby. What is ankle sprain? Ankle sprain is a common sport injury that occurs when you twist or roll your ankle in an awkward way. This ankle sprain is common happen in the sport that involving the movement such as jumping and running like rugby. Okay, the symptoms of this ankle sprain is bruising, swelling, and of course the pains at the ankle. And yes, this ankle sprain happen because of the improper shoes that the athlete wearing or the uneven surface of the field or the place that the rugby teams play or training there. Okay, let's check it out. What's happened and how to treat the ankle sprain if the athlete or the players having the ankle sprain during the games. Let's go. Let's check it out. What happened.
My ankle.
Let's go for a better place. Okay, you rest here. I will take the first aid. Wait for a minute. What do you feel? Yes.
Is it?
Yeah.
That's it.
Because you need to rest your body, don't move, okay? Yeah. Now close your eyes. Yep, start. Right. This bandage is used for compress your injury part. Okay. But don't worry, you just need to rest. And lastly, I use the elevation to elevate your injury part. Okay. If this injury getting worse, please see the doctor to check up. Okay. For now, you just rest of your body to recover this injury part. Okay. Alright.
Assalamualaikum warahmatullahi wabarakatuh. My name is Farah Natasha binti Sukarman and I'm from SR134C. Today I want to show how to treat hamstring strain. Hamstring strain are produced by a quick or extended contraction or a violent stretch of hamstring growth muscle. Hamstring strain are common in sport with dynamic character like jumping, sprinting, such as in sport football, rugby and running. Okay, let me tell you how to treat the hamstring strain. Okay, first we use RICE method, which R is rest, ice, compression and elevation. Okay, for the rest is you must straight your leg and I will push her leg for 20 seconds. Okay, then I will push her back for 20 seconds too. Okay, for the second method is ice. I will use this ice pack to reduce pain and swelling. I will put this ice pack back at the hamstring like this. I will put it for 20 seconds until the pain is gone. Okay, the third method is compression. Compression is do not give the pressure to your hamstring because it can make strain again. And the last one is elevation. Elevation is when you at home, you must rest your leg and then put your leg on a pillow when you are sitting or lying down. Okay, that's all from me about how to treat the hamstring strain or hamstring muscle.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nurhani Azira binti Makno. I'm from SR134C. So today I will do injury management. Okay. So I will do injury management for fracture dislocation of the thumb for a rugby player. Okay. So firstly, dislocation and fraction. Okay. So dislocation is complete displacement of a joint from its normal alignment, while a fracture is a complete or partial break in the continuous bone. Okay, so in this part, I will do treatment for the injury and how I manage to do the injury management as a first aider using RICE protocol, which is R for rest, I for ice, C for compression, and E elevation. Okay, I will do and use these 4 protocol for the injury management of the player. So the treatment for dislocation of the thumb is firstly I will do the assessment victim assessment, which is I will check the player first, the victim, whether she fine or not, and then I will make sure the injury not heavy, or as I will call emergency to handle the case, and then for the treatment I will use rice. Okay, so first I will ask the victim to rest, and the second one I will use ice pack to reduce her pain at the injured part, and then third compression, which is I will do bandaging or use splint to support the dislocation part, and then lastly elevation. I will do I will keep follow up her injury so that I can help her to heal or reduce her pain. Are you okay? Okay. Are you hurt? No. Okay, let's move first. Okay, so now I will give you medical treatment. Okay, first I will put cooling pad so it will reduce your pain. This cooling pad you can put in between 2 hours. Okay, next I will secure first because you had dislocation of your thumb, so I need to give support to the bone and joint. Are you okay?
I'm okay. Untuk tengok.
Okay, so this method will prevent your thumb from any serious injuries after this dislocation. Okay. So you may use this cooling pad in between 2 hours until your pain heal. Okay.
Okay.
Assalamualaikum warahmatullahi wabarakatuh. I'm Nur Atifa binti Muhammad Aziz from SR 1134C. Okay, so I will explain about the laceration on our face. Okay, first of all, what is laceration? Laceration is one of the open wound types, and it can be anything small, minor scratch, to deep bleeding cut. Okay, it is often caused by a blunt object. In rugby, footwear is one of the factors that can cause to the laceration. It usually occurs when players do the ruck or stamping and tackle from behind or from front. Okay, so when you need to call 911 or seek for further medical treatment, first one, if your laceration is bleeding severely or spurting, and then another one is if your cut is more than 1 to 4 inch long or deeper, you need to seek for medical treatment because it may need stitches to treat that wound. Okay, so now I will show you guys how to treat laceration wound on our face. Okay, first of all, you need to wear a glove so that we can avoid any infection during the treatment process. Okay, so first one is you need to apply a direct pressure on the wound to stop the bleeding. You can use any clean cloth or gauze. After done applying the direct pressure on the wound, you can use any washcloth or a cotton to gently rub and dab around the wound so that we can remove all of the dirt. Okay, next we will apply some antibiotic ointment, and lastly we need to cover the wound with a gauze bandage and the medical tape. Okay, so that's all for the first aid for laceration wound on the face. Okay, so don't forget to change your bandage at least once a day or when it gets wet or dirt to promote a faster healing and avoid any infection. That's all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Farouk bin Sufyan and I'm from SR 1134C. First of all, very good morning to my beloved lecturer, Miss Aisha. So today I will show you that how to treat people or victims that face out the head concussion. So first of all, you guys need to know what is head concussion. So head concussion is a traumatic brain injury that affect your brain function. Head concussion also affect are usually temporary but can include headache and problem with concentration, memory, balance and coordination. Head concussion usually caused by blood flow to the head. So for the symptom of the head concussion, we will see that the victim will feel headache, feel dizzy, and also ask them for their memory, and we will look for the fully their fully condition. Is it look weak and not feel well? So I think without we wasting our time, we can proceed to the demonstration that how to treat the head concussion. So let's go. So hello guys. Before what I said before this, I said that I will show you the full demonstration that how to treat the head concussion. So first of all, before you want to treat people, you need to ask if we can touch he or her. So may I touch you? Okay. After that, for head concussion treatment, you need to let them down first. So can you up and sit down properly? So after that, you identify where is the head concussion happen at her head. So can I know where is the head you feel? Oh, here. Okay, good. So after that, you put some ice for or cool pack at her pain at her head for 2 until 3 minutes. So after you finish, after we finish for 3 minutes, put the ice, and then you use the AVPU concept or AVPU concept, which is A for alert, V for voice, P for pain, and U for unresponsiveness. So for A alert, I will show to you. Can you see my finger? Okay, done. After A, we use then next is V, her voice. So what is your name?
Zara.
What sport do you play right now? Just now? Rugby. So for based on that, we can see that he more better. So for the P pain, that you feel dizzy or headache. Okay, did you feel more feel weak or want headache, or that do you memory loss? No. Okay, for based on this, we can say that the Zara face out the just a minor concussion injury, head minor injury, concussion injury, not a major. So for the U, responsiveness, we can conclude after we ask for the 3 question just now. So she respond very well, but he already feel he is or head concussion. So for the next step, ask he or she can we bring out to the field to not disturb for the game. So can I bring you out to the field? Okay, good. So after we bring she out of the field, the game we will continue, and we'll ask she did you feel more better or not. After that, we need to give she a rest for be more better. If he feel more serious or critical injury, we need to call 999 to settle this pain, the serious pain. So I think that's all from me that show to the demonstration about the head concussion. So I think that's all for me. If I have some mistake, I'm very sorry, and I hope that I show this video and you will watch with happily. So I think that's all. Thank you.